Do you notice a lot of hair falling out when you comb your hair? Do you wake up and see many strands of hair on your pillow? Does hair collect in the drain when you shower? Is your scalp becoming clearly visible? Is the hairline on your forehead moving backward? Is the hair on the top of your head becoming thinner? If your answer is yes, you are not alone. Hair loss is one of the most common yet worrying problems in today's world. In today's video, I will tell you about a special natural solution. If you follow this solution regularly, within 40 days your hair fall will start to decrease and new hair will begin to grow. But I will not reveal that solution right now. First, I will explain why our hair falls, what hair is made of, why hair is important, what causes hair problems, what symptoms appear, and how we can naturally control hair loss. Then at the very end, I will reveal the special natural solution. If you watch the video until the end, you will find out. This video is a bit long. It will take about 40 to 45 minutes to watch the whole thing. But if you are busy, there is nothing to worry about. You can watch the video in 2 or 3 parts. Watch a little today and a little tomorrow. You may even take 5 or 7 days to finish it. My sincere request is that you watch the entire video until the end, because the most important information is at the end. If you miss that part, your time will be wasted. So however long it takes, please watch the full video. Do you know that a healthy human head has on average about 100,000 to 150,000 hairs? And losing about 100 to 150 hairs per day is completely normal. Hair falls out and new hair grows again. But when the amount of hair fall becomes higher than normal, it becomes a cause for concern. How can you understand the amount of hair fall? You can count your fallen hair for 3 days. Or gently pull a small bunch of hair. If about 1/4 of the hairs come out, it may be a matter of concern. What is hair made of? Hair is mainly made of a protein called keratin. About 97% of hair is protein and about 3% is water. The part of the hair that we see is actually made of dead cells and has no sensation. Hair grows about ½ an inch per month. A hair usually grows for 2 to 4 years, then the growth slows down and eventually it falls out. The average lifespan of a hair is between 2 and 8 years. Now let's discuss the main causes of hair loss. Knowing the causes is important because without understanding the cause, the right solution is difficult. The first and most common cause is genetic or hereditary factors. In medical terms, this is called androgenetic alopecia. If your parents or grandparents have hair loss, you are more likely to have it as well. In men, this often appears as a receding hairline and baldness on the top of the head. In women, hair may become thinner across the scalp, especially on the top. The second cause is hormonal imbalance. Androgen hormones can cause hair loss. These hormones are higher in men but also present in women. If the body is more sensitive to these hormones, hair loss increases. Thyroid hormone imbalance can also cause hair fall. In women, hair loss can increase during pregnancy, after childbirth, and during menopause due to hormonal changes. Women with polycystic ovarian syndrome, PCOS, also experience more hair loss. The third cause is nutritional deficiency. If the diet lacks essential nutrients, hair loss increases. Protein deficiency is particularly important because hair is primarily made of protein. Iron deficiency leading to anemia can also cause hair loss. Lack of zinc, biotin, vitamin D, vitamin E, and omega-3 fatty acids may contribute as well. The fourth cause is stress. Excessive stress can increase hair fall. In medical terms this is called telogen effluvium. Severe stress causes many hair follicles to enter the resting phase at the same time. After a few months, a large amount of hair may suddenly fall out. However, this condition is usually temporary. When stress decreases, hair often starts growing again. The fifth cause is physical illness. Diseases like typhoid, jaundice, malaria, and diabetes can cause hair loss. High fever, major surgery, or rapid weight loss can also increase hair fall. Sometimes hair takes time to recover even after the illness improves. Certain autoimmune diseases like alopecia areata and lupus can also cause hair loss. In alopecia areata, the immune system attacks the hair follicles, causing round patches of hair loss. The sixth cause is medication side effects. Some medicines may cause hair loss. For example, chemotherapy used for cancer treatment causes hair loss, known as anagen effluvium. Birth control pills, blood pressure medications, blood thinners, psychiatric medications, and thyroid drugs may also cause hair loss. The seventh cause is scalp problems. Dandruff or fungal infections are common causes of hair loss. If the scalp becomes itchy, red, or flaky, hair fall may increase. If the condition lasts a long time, it can damage hair follicles permanently. The eighth cause is excessive cosmetic treatment. Chemical treatments like hair coloring, bleaching, straightening, rebonding, and perming can damage hair. These processes weaken hair and increase hair fall. The ninth cause is tight hairstyles. Tight ponytails, buns, or braids pull on the hair roots. Over time, this can lead to a condition called traction alopecia. Once this problem develops, hair may not grow back easily. The 10th cause is aging. As people age, the activity of hair follicles decreases. The rate of new hair growth slows down. Hair becomes thinner and gradually turns gray. Now let's discuss the symptoms of hair loss. Symptoms can vary. The first symptom is gradual thinning of hair. This is the most common sign. In men, the hairline at the temples begins to recede. In many cases, hair loss also occurs at the crown. In women, hair may thin along the middle part or across the top of the scalp, making the scalp visible. The second symptom is sudden hair shedding. Due to stress or illness, a large amount of hair may fall out at once. Hair may come out easily during combing or washing. The third symptom is circular bald patches. Alopecia areata or fungal infection can cause round bald spots on the scalp. The fourth symptom is hair breakage. Excessive chemical treatments or heat can weaken hair, causing breakage and split ends. The fifth symptom is itching or burning on the scalp. Dandruff or infection can cause itching, redness, and flaky skin on the scalp. Now let's talk about ways to control hair loss. The first and most important step is maintaining a healthy diet. Since hair is mainly made of protein, daily meals should contain adequate protein. Eggs, fish, chicken, meat, lentils, chickpeas, soybeans, milk, yogurt, cheese, and nuts are good sources of protein. Iron-rich foods such as leafy greens, beetroot, raisins, liver, and meat are also important. Vitamin C helps absorb iron. Foods rich in vitamin E, B-complex vitamins, zinc, and omega-3 fatty acids such as nuts, seeds, fish, dark chocolate, and avocado should be included in the diet. Second, drink enough water. Drink 8 to 10 glasses of water daily. Water maintains scalp moisture and strengthens hair roots. Third, reduce stress. Practice meditation, yoga, and breathing exercises. Spend time on hobbies and with friends. Adequate rest helps maintain hormonal balance and reduces hair loss. Fourth, get enough sleep. Sleep 7 to 8 hours every night. During sleep the body repairs itself and hormones are regulated. Lack of sleep increases stress and hair loss. Fifth, keep the scalp clean. Wash hair 2 to 3 times per week with a mild shampoo suited to your hair type. Avoid washing too frequently and avoid very hot water. Use lukewarm or cool water instead. Sixth, massage oil into the scalp. Regular oil massage increases blood circulation and strengthens hair follicles. Coconut oil is very good. You can also use mustard oil, castor oil, or olive oil. Massage warm oil 2 to 3 times per week and wash it off after half an hour or the next morning. 7th, use natural hair packs. Fenugreek is very beneficial. Boil 1 teaspoon of fenugreek seeds in half a cup of coconut oil for a few minutes, cool it, and apply it to the scalp. Aloe vera gel can be applied directly to the hair twice a week. An egg yolk mixed with honey can be used as a hair mask. Apply it for half an hour before washing. Onion juice applied to the scalp is also very effective. Henna leaves boiled with mustard oil can also be used. Olive oil soaked with cumin and mixed with honey may also be used. 8th, avoid excessive chemical treatments. Hair coloring, bleaching, straightening, rebonding, and perming should be minimized. 9th, avoid excessive heat. Frequent use of hair dryers, straighteners, and curling irons can weaken hair. Let hair dry naturally. 10th, comb hair properly. Do not comb wet hair because it is very fragile and breaks easily. Comb hair only after it dries. Use a wide tooth comb rather than a brush. 11th, avoid tight hairstyles. Tight ponytails or braids pull on the roots and increase hair loss. 12th, quit smoking. Smoking reduces blood circulation in the scalp and weakens hair follicles. Now let's address some common myths about hair loss. One myth is that hair loss only comes from the mother's side of the family. In reality, it can come from either side. Another myth is that cutting hair makes it grow faster. In truth, cutting hair only improves appearance. Another myth is that wearing hats causes baldness. This is false unless the hat is extremely tight. Another myth is that cold water prevents hair loss. Cold water may improve circulation but does not stop hair fall. Another myth is that hair loss only occurs in old age. In fact, even young people can experience hair loss. When should you see a doctor? If hair loss begins suddenly or becomes severe within a few weeks. If round bald patches appear. If hair loss occurs along with redness, itching, or scaling of the scalp. If hair loss occurs along with fatigue, weight loss, or irregular menstruation. If hair loss starts after beginning a new medication. Or if home remedies do not help after 6 months. Doctors may perform several tests. They may ask about your medical history and family history. They may examine the scalp and perform a hair pull test. They may conduct trichoscopy using a magnifying camera to examine hair follicles. Blood tests may check iron levels, vitamins, thyroid hormones, and other hormones. In some cases, a scalp biopsy may be done. Treatment options may include minoxidil, which helps reduce hair loss and stimulate new growth. It is available as a gel or lotion. Finasteride is used in men to reduce hormone-related hair loss. Steroid injections may be used for alopecia areata. Hair transplant surgery is another option, though it can be expensive. Now I will finally reveal the special natural solution I mentioned earlier. It consists of 3 methods. First is a mixture of fenugreek and coconut oil. Boil 1 tablespoon of fenugreek seeds in half a cup of coconut oil for 5 minutes on low heat. After it cools, strain the oil. Massage this oil into your scalp every night before sleeping and wash it off with a mild shampoo in the morning. Second is an aloe vera and egg mask. Beat 1 egg yolk and mix it with 2 tablespoons of fresh aloe vera gel and 1 tablespoon of honey. Apply it from root to tip once a week for half an hour, then wash with herbal shampoo. Third is a mixture of onion juice and castor oil. Extract juice from 1 onion and mix 1 tablespoon of it with 2 tablespoons of castor oil. Apply it to the scalp once a week and wash after 1 hour. If you follow these 3 methods regularly for 1 month, you will notice reduced hair fall. After 3 months, your hair will become thicker, stronger, and shinier. I remember a friend of mine who suddenly experienced severe hair loss after her marriage. She became so worried that she couldn't sleep at night. She consulted many doctors and changed many shampoos, but nothing worked. Finally, she started these natural remedies. After 3 months, her hair loss completely stopped and her hair became thicker and more beautiful than before. Now she recommends these methods to others. Finally, do not panic about hair loss. It can be controlled with the right knowledge, patience, and consistency. Your hair is an important part of your appearance. Taking care of it is your responsibility. From today onward, follow these habits: eat properly, sleep well, reduce stress, massage oil regularly, and use natural hair packs. Within 21 days you will notice reduced hair fall, and within 99 days you may hardly recognize the improvement. Take responsibility for your hair care starting today. Begin the special natural solution today: massage fenugreek oil at night, apply the egg and aloe vera mask weekly, and use the onion and castor oil mixture. With regular use, you will see results. Share this video with your friends. Someone you know may be struggling with hair loss, and this video might help them. Leave a comment below and tell us about your hair loss problem and what results you achieved after following these methods. Your experience may help others. Remember, healthy hair is a symbol of confidence. Take care of yourself. Your hair is part of your beauty, protect it.